I'll give you a little tour of the hospital, here. This is our, birthing area. This is an American style, birthing bed. Came out of an American hospital. But Tarahumara women traditionally deliver in the forest hanging from a tree branch. So we've sort of tried to duplicate that here. It's a tree branch, which is a trapeze and a bed. Our laboratory. Buenos dias, David. Yeah. I mean, it's because of a lot of miniaturization of electronics now. You can do a lot of stuff, in a very small space. We can do, 90% of the tests that a big city hospital can do here. Pediatrics ward, and they're doing rounds right now. And this is our women's ward, which right now doesn't have a lot of women in it. Actually, because our men's ward has overflowed, we've got one male patient here. Pharmacy area, pretty well stocked. This is our emergency room. Because we do receive emergencies. It's actually got 2 beds, as you can notice.
Give me an idea of some of the kind of emergencies that you've had to deal with here.
Trauma, obviously. We do have car wrecks here. Gunshot wounds, unfortunately. People that, that fall. It's pretty common here in the mountains. Sick babies. We get a lot of kids who are, with diseases related to malnutrition, bad, you're talking about bad pneumonia or gastroenteritis. The most common cause of death of children in the third world is bad water, gastroenteritis, and the associated malnutrition and chronic illnesses, associated with just drinking bad water. So this is where the doctors would see the patient first if they're brought in. This lady had a fracture of the wrist, which was intra-articular. The end of the radius, this bone here was shattered in several pieces. And one thing you can do, we've noticed, is that if you pull and put traction across the fracture, the pieces line up. If you have no traction, everything starts to collapse and you get wrist arthritis. So if I wanted to stand here for 6 weeks like this, she'd end up with a pretty good wrist, but I don't want to stand here for 6 weeks. So I put this device on, which has 2 pins in her hand bones and 2 pins in the radius or forearm bone, and then 10 pounds of traction pulling them apart. And so this device will just maintain traction across the fracture while it heals. And we'll see how the x-rays go, but 5 weeks or so, maybe 6, we'll just take it off.